Hi, this is Ron, and I'm in my clinic in Oliveira do Hospital in the eastern parts of Portugal. And what I want to do today, I want to show how to work with a roller. So, just to make it clear, I'm not using a foam roller because it's not. I don't get what I need from that roller. The roller I use is actually, I can show you that it's a PVC. Tube. Open it. I actually got it from my daughter. You see what I have here, and there's a sock on it. This one is called the Fascinator, and it's actually made by an osteopath in Hawaii. I got it from my daughter from Hawaii, and I used his instructions to begin with in order to work with this roller. And after trying it for a while, and it works amazingly well, and I explain why it works amazingly well, I started to research, to try to do some different things with it, and I have my own way of working with a roller. What I use a roller for? First of all, I use it for maintenance. If I do stretching or yoga on a daily basis, I do my roller session at least once, or if I'm very painful, I do it at least twice a week. If the stretching works mostly on my muscles and the nervous system that connects to the muscles and so on, this type of a roller, which is extremely, extremely stiff, works more on my fascia. I'm not going to get into the fascia, what it is and all that. That's for a different session. But sometimes, and I already experienced it in the past, I had pain in my body and stretching did not take it out. And I found out that working with a roller did the magic. And therefore, I use this roller on a regular basis, as I said, for maintenance, to avoid getting injured. And I work a lot with a roller like that with my patients. If they are injured, I help them to find the right places where they need to roll or iron themselves in order to work with a roller to get injuries out. What I want to do today is I want to show how I work with a roller, how I do a full body session with this thing. I'm going to show only one side, but everything I do on one side, of course, needs to be done on both sides. So, as I said, I use a very stiff roller, and the reason for that, I wanted to really iron hard the parts that are stuck. And I had a patient in the past. She was from Finland, and she told me that they call this in Finnish the torture roller. And that's exactly the way it should feel. It should feel very painful. And when you find the places which are more painful, this is exactly where you need to work even more. So what I do, how I use it. I usually start with my feet, and I use, again, each time I use a different leg. And I start with not laying on the ground, but just sitting on the ground. And what I do is I just roll myself. I start with my calf muscles and soleus, and I just roll myself. And I'm looking for a place, as I said, which has to be or will be a bit more painful. And if I don't find any, that means that everything is fine. And if you can see what I do, I turn my leg around because there are more places where I can work. I turn my leg to the outside. I turn it to the inside. And I just roll on it. After I do that for a couple of minutes, right now I found a place that hurts more after this weekend's training. Good. I can roll more on it. Then I move to the back of my knee. This is not something that is usually used, but in Chinese medicine there are some very important acupuncture points in this area, so I usually iron them as well. Those points actually have to do with the back, and these are the control points for the back. So I iron them as well. I can really feel that. This is where it really hurts now. This area over here. And after a couple of minutes of that, I move up to my hamstrings and I'll iron them as well. There are two heads of hamstrings, so I turn a bit to the right and a bit to the left to make sure I iron most of them or all of them. I move up to my glutes, to this connection tissue. You know the pain that sometimes people have in the connection between the hamstrings and the glutes? That's absolutely perfect for that. I'll move up to my glutes. Don't know if you can hear that, but it's good. It hurts. Exactly the way I want it to do. And from here, I'm going to stand up. Don't know if you can see that properly, but I'm going to stand up and I'm going to iron my feet. And again, I'm looking for places which are going to be more sore and I'll spend more time in them. Good. After I'm done with the back of my leg, I'm going to go to the other leg, which I'm not going to throw today. And then I'm moving to the front part of the leg. I'll do the same thing. I'm going to start with the lower part, gently, because it hurts, really hurts, because there is a bone over there. Very, very thin tissue, but I can really feel that on the side of my leg. And then I'll move up to above my knee, to my quadriceps. And I'll do the whole thing, and a bit to the upper part. And after I'm done with that, I'm actually going to go to my hip flexors as well. And if your hip flexors are tight because of running, that's absolutely perfect. Be careful on your private parts, of course. After I'm done with that, I'll do something again that I found very helpful. Work on my ITB. This is going to be probably even more painful than the rest of the stuff. So I'll do it gently, and I use my hands, my upper body to really know how much pressure I want to apply on my ITB. Actually, it's not too bad. All the way up to the hip. And since the ITB is connected all the way here, I'll go all the way up to, until I get to the connection. Done. Then I'm going to do my inner thigh. Inner thigh is a bit more complicated to do, but we'll try to find a way to do that as well. Usually I'll just lay on it and just my leg, I don't know if you can see that, I'll try to show you the other leg. That's why I work on my inner thigh. Okay, done with my legs. The next thing I'm going to do is work on my hands, and then I'll move to the rest of the body. I'll do the same thing. I'm going to start with the, I'll show you one hand, and I'm actually do it from that side. It's going to be easier to see. I'm going to iron all the parts of the hand and turn it around and to the back of the hand and turn it around to the inner side. If you have any problems of tennis elbows or golfer's elbow, this is a solution. And then to the other part, the upper part of the hand. And turn it around. And many times, especially if you train a lot, you're going to have pain in this area over here. So I'm just going to lay on it. And it hurts. And turn. Good. Done with my hands. One hand. Remember there we have a second one. Then work on my hands. On my fingers. Good. Next thing to work on is going to be my back. I'm going to start with my lower back, and this is the only place which is a bit more, we need to be a bit more careful, because what I do is I do not use the roller on both sides of my lower back, because we have the spine. I'm going to take it, put only on one side only. And then I'm going to work on the lower part on one side only. And when I get to the upper part of my back, then I'm going to work on both sides together. So it looks like that. And again, I'm going to lay on one side, making sure that I'm not hitting the spine here. And I'm going to roll on it. Then the other side, and then when it gets to the upper back, I can easily use both sides together. Then we get to the neck area, upper shoulders and neck area, which are amazing. We'll do the upper back and shoulders first. And then we'll do the neck. What I do with the neck, I actually put my neck on the roller and look for painful points, and I'll just turn around from side to side. And stay in those points. I know in my case, it's the other side is going to be the painful one. And yes, it is. The last thing that I can do, and it's not a necessity in most cases, is to work on my stomach as well. We have fascia there as well. You need to be careful not to crack any rib here. Then we can do the chest. And upper chest. And shoulders. I can really feel my shoulder. And that's it. So, as I said, I use I use the roller for maintenance. I do the whole body. You saw it takes 10-15 minutes to do the whole thing. I do it at least once a week to do that. And if I fail to do that and or if something starts hurting more, then I'll use a roller to fix it. For example, in my case, I had long bike rides the last few days, and most of the pain I have, because I live on mountains and it's up and down hills, is going to be my shoulders and my hands. And my backhand hurts, so I'm going to work, and I feel the pain in this area over here. But I know that the problem is not here, it's going to be somewhere here. Everything is tight. So I'll use the roller in order to open up the area over here. If you have a specific pain and you're not so sure where to use it, as I said in my session in Hebrew, this is where practitioners like I am, we can help. We can tell you, okay, if it hurts, if you have a golfer's elbow and it hurts here or it hurts on the other side, golfer's is here and tennis elbow is on this side, I can show you where to look for pain. And this will really help you to open it up. If you have any questions, feel free to leave me a message in the comments. Feel free to contact me, and I'll be happy to help. Enjoy torturing yourself. Bye-bye.